Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Rashidi bin Saiful from DLS4A. My matric number is 23DLS 19F2045. So today our group will present about Clinical Decision Support System, CDSS. So firstly is the definition of Clinical Decision Support System. A clinical decision support system is a health information technology provides clinicals, staff, patients or other individuals with knowledge and person-specific information intelligently filtered or presented at appropriate times to enhance health and healthcare. So next is the medication that related clinical decision support system. A medication related clinical decision support system, CDSS, is an application that analyzes patient data to provide assistance in medication related care process. The second one is to improve the clinical decision in making process. Evidence show that clinicians do not always use CDSS in such a way that their potential can be fully realized. And lastly is this systematic literature review provides an overview of frequently reported barriers and facilitators for acceptance of medication that related to CDSS. So that's all from me. I will pass to Naza.
My name is Muhammad Azhar bin Ma'arifin and my matric number is 23DLS19F2013. So today, I would like to present about benefit and advantages of Clinical Decision System Support, or also known as CDSS. Okay, firstly, the benefit and advantages on clinical management. Studies have shown that CDSS can increase adherence to clinical guidelines. This is significant because traditional clinical guidelines and care pathway have been shown to be difficult to implement in practice with low clinical adherence. The assumption that practitioners will read, internalize, and implement new guidelines has not held true. However, the rules implicitly encoded in guidelines can be literally encoded into CDSS, Such CDSS can take a variety of forms, from standardized order sets for a target case, alerts to a specific protocol for the patient it pertains to, reminder form testing. Furthermore, CDSS can assist with managing patient on research or treatment protocols, tracking and placing order, follow-up for referrals, as well as ensuring preventive care. Okay. The next benefit and advantage of CDSS is on patient safety. CDSS also improve patient safety through reminder system for other medical events and not just those that are medication related. Among numerous examples, a CDSS for blood glucose measurement in the ICU was able to decrease the number of hypoglycemia events. This CDSS automatically prompted nurses to take a glucose measurement according to a local glucose monitoring protocol, which specified how often measurement should be done according to specific patient demographic and previous glucose levels or trends. Overall, CDSS targeting patient safety through CPOE and other systems have generally been successful in reducing prescribing and automated warnings, drug event monitoring and more. Patient safety can be considered a secondary objective of almost all types of CDSS, no matter the primary purpose for their implementation. The next benefit and advantage of CDSS is consistent data. CDSS is providing reliable and consistent data and information to the healthcare team. This system can outline the evidence-backed information, especially if there is an emergency. Also, the information provided will be quick and accurate, promising better healthcare decision making. Okay, next I will explain about why CDSS is important. CDSS is important because the main purpose of CDSS is to provide timely information to clinicians, patients and others to inform decisions about healthcare. Example of CDSS tools include order sets created for a particular condition or type of patients, recommendation and database that can provide information relevant to particular patients, reminders for preventive care and alerts about potentially dangerous situation. CDSS can potentially lower cost, improve efficiency, and reduce patient inconvenience. In fact, CDSS can sometimes address all three of these areas at the same time. For example, by alerting clinicians about possible duplicate tests a patient may be about to receive. Plus, over the years, the CDSS has quickly become one of the most efficient and leading tools from digital health solutions who are looking for an automated and specialized tool to manage large volume of data and be able to deliver high value and efficient medical service to patients. So, that is why clinical decision support system is important because it's not just about the cost and time, but in fact, each decision you make in healthcare environment can lead to life or death consequences.
Thank you, Nazar. Next, my name is Muhammad Ahmad Faris bin Nazri. My matrix number 23DLS1NF2031. And today I will present about example and challenge of CDSS, Clinical Decision Support System. Okay, first is the example of CDSS. Example of such CDSS include Laboratory Information System (LIS), highlighting critical care values, or Pharmacy Information Systems (PIS), presenting an alert, ordering a new drug, and proposing a possible drug-drug interaction. Next, example of CDS tools include order sets created for particular conditions or types of patients, recommendations and databases that can provide information relevant to particular patients, reminders for preventive care and alerts about potentially dangerous situation. Next, I will talk about CDSS challenge. Two important healthcare sectors that CDSS has had a significant impact on the pharmaceutical and billing sectors. They are commonly used pharmacy and prescription ordering systems that now perform batch-based order reviews for negative drug interactions and report alerts to ordering professionals. Another section of success for CDSS is in billing and claims filing. Next, the maintenance. One of the core challenges facing CDSS is difficulty in incorporating the extensive quantity of clinical research being published on an ongoing basis. In a given year, tens of thousands of clinical trials are published. And currently, each one of these studies must be manually re-evaluated for scientific legitimacy and incorporated into the CDSS in an accurate way.
My name is Arif Hakim bin Yaakob and my matrix number is 23DLS19F2025. And I will present about two main types of clinical decision support system in supply chain management. The two types of clinical decision support system, which is CDSS, are knowledge-based and non-knowledge-based. I will go first to knowledge-based in CDSS. Most CDSS consists of three parts. The first one is the knowledge-based, an inference engine, and a mechanism to communicate. The knowledge base contains the rules and associations of compiled data, which more often take the form of if-then rules, which is in rules-based system. If this was a system for determining drug interaction, then a rule might be that if drug X is taken, and drug what is taken, then alert user. Using another interface, an advanced user could edit the knowledge base to keep it up to date with new drugs. The inference engine combines the rule from the knowledge base with the patient data. The communication mechanism allows the system to show the result to the user as well as have input into the system. And next, for a non-knowledge based clinical decision support system (CDSS), which is it do not use a knowledge-based use a form of artificial intelligence that's called machine learning, which allow computers to learn from the past experience and find patterns in clinical data. This eliminates the needs for writing rules and for expert input. However, since systems based on machine learning cannot explain the reason for their conclusion, most of clinicians do not use them directly for diagnosis for reliability and accountability reasons. Nevertheless, they can be useful as post-diagnostic system for suggesting patterns for clinical to look in more depth. At this moment, three types of non-knowledge-based systems are support vector machine, artificial neural networks, and generative and genetic algorithm. And the last one is the conclusion why clinical decision support systems are important for supply chain management. Clinical decision support system, which is the CDSS, have been shown to augment healthcare provider in a variety of decision and patient care tasks. And today, they actively and ubiquitously support delivery of quality care. Some application of clinical decision support system have more evidence behind them, especially those based on CPOE, which is computerized physical order entry. Support for clinical decision support system continues to amount in the age of the electronic medical record, and there are still more advances to be made, including interoperability, speed and ease of development, and affordability. Thank you. That's all from our group. Thank you for hearing.